Sorry, I'm just getting ready for the uh, live, and I'm just doing last minute announcements. And I think we have 6 minutes left. And looks like at least two people are here. So if you have any questions, just write it down in the comments, and I'll try to get to them. And thank you for being here. I didn't make any announcement. This 10:30, I think, is a good time for me to do a Facebook Live. Yesterday we did it at 6:30 p.m. and what I'm looking for is a time that works in the U.S. but also for our international members. So this time actually is a good time, I thought, for um, London time, about 4:30 London time GMT, and then for yesterday 6:30 was about 11:30 a.m. Saturday. But Australia is I think a day, almost a day, or more than a day ahead of us. So I'm trying to just find two times that works well for us, and that eventually we will settle on a time that would work for most of the group. So welcome, happy Saturday, happy weekend. I feel like most of us are living and working for after 5 p.m. And we're also working after like on Saturdays, Sundays, where we have some of our life back. So I thought that that's the way. So welcome back, Michelle. I feel like I know Michelle. um, so don't worry. I got your. I think you put your question in school, so I will answer that. So and someone wrote the question is, did anyone experience worsening anxiety a week or two after starting? Did you continue or whatnot? Any input would be greatly appreciated. And I think I mean, it's just so well written and very considerate and very compliant with the what Facebook likes. So thank you for that. Even though it is in school, I really appreciate it. I think the answer goes back to what we talked about yesterday, last night, which is we have to look at how much this person is endorphin depleted. So, would you care to guess how many conditions this person has? Has this person had the condition for a long time? So that's some of the questions I ask. Is this person a very sensitive person to medications? Has this person had the condition very long time? Is this person of high vitality? So if the answer is no, the person is not of high vitality. Yes, this person has had the condition for a long time. Yes, this is a very sensitive person to medication. Right there, I would say my experience tells me that this person may benefit from the lowest amount that can be compounded. Notice I don't talk about exact doses, but Michelle knows what what I'm talking about, what the dose we're talking about, and that is the dose known as ultra low dose naltrexone in the literature, not by me. And I have an article that I wrote with my team in University of Kansas regarding ultra low dose naltrexone, and that paper is available for free at my website. You can just look for it, and then the other thing is that has this person had this condition for a long time? And I think that sometimes the sensitivity, um, and this is the website that has that article that I was talking about, using LDN for chronic pain, and especially um, using the ultra low dose naltrexone. And there are three reasons I use ultra low dose naltrexone. I have a YouTube video on this topic. And the first is all pediatric children. I just prefer to start them on low because those of you who have children know that our attachment to our children is really deep. And having a issue with our children, that's a different level of suffering than just we go into suffering. So the second reason is people who are very sensitive and who's had side effects from LDN in the past. I recommend that they restart at 1 microgram. That's another reason to do it. Another reason would be if they're taking opioid medication, because that would also be another reason why I would start the lowest dose possible in the U.S. that just happens to be about 1 microgram. So again, I am Dr. Yoon Han Kim. I'm a licensed medical physician, and I also want you to know that all these are for your education and not a medical advice. For medical advice, please go to your doctor and obtain medical advice. For prescription support, go to your pharmacist and ask them. So the person is saying that worsening anxiety after 1 or 2 weeks. I would say that nobody really understands. There's not a study on how long does the endorphin blockade last, so we don't know that. The second is, I, I think individuals are going to have individual ability to overcome the blockade, and I think the people who are endorphin depleted probably will take more effort, time to overcome it. So in that context, I'm going to guess, I don't know anything, but I'm going to guess that this individual probably is endorphin depleted, probably is sensitive, probably the condition is taking a lot out of them, and probably the person's vitality has been affected. Now, what do I mean by vitality has been affected? It's very simple. I mean, when you get up, do you have a lot of energy that you are ready to face the world? When you come home and you're tired, do you have energy to do things you love? Can you pursue things that you'd like, or are you just surviving in between visits? So if the person is depleted, I think likely, in my opinion, that depletion of this condition really means that there's benefit to going with the lowest dose possible and increasing very slowly. I know it's not popular advice because we just want results right away. Yesterday I shared for a specific reason for myself when I had my neuropathy come back, very unpleasant, very, very unpleasant. So I did a thing that I don't recommend to patients, and sometimes I'll do that, and because I know that I want to get to the effective level, and my neuropathy is much better thanks to LDN, but I did have to go through a lot of side effects, and I would take the dose and then take a day or 2 days break. I would re-challenge, take 1 or 2 days break, re-challenge, and so at the end I was able to take like 4 times the amount of what I was given, and I got really great results. So now I'm backing off and try to control everything through diet. So how the anxiety, depression, the feeling of fatigue, just feeling really down, I think those can be related to the blockade of the endorphins. Endorphins are strictly not neurotransmitter, but they kind of function like it in a way, because like dopamine, the reward, endorphin has a reward, natural high people talk about, and the second is happiness. Endorphin gives you happiness. So I think that our body is really incredibly, amazingly smart, so that it's got multiple different ways in which we can operate. And I think this is just one way that we can operate, not just the serotonin, the norepinephrine and dopamine, but also through endorphin. And I think the endorphin is really amazing tool that we have. And if you don't have a lot of it, and then if your serotonin system is already under attack and dopamine system is under attack, then I think that it just makes sense that the symptoms coming from lack of serotonin would be triggered. So that could be emotional distress is what I like to call it, but there can be anxiety, depression. But again, talk to your doctor. And I know, Michelle, you said that your doctor kind of leaves you alone, but I think people have to find what they need, and that's what they have to do. So I think this was like a pop up because I didn't do. Um, I'm basically I didn't really announce this at all. I just thought that what would be like for me to just start one at this time. I think the 6:30 Friday seems to be a better time, but and usually Saturdays I try to do nothing. That's my day of rest by choice, not religious reasons, but by choice. Because Fridays I start seeing some patients Sunday afternoon, and then I prepare for the rest of the week. So Michelle, you are really I'm proud of you because you are very um, persistent, and from my experience of how things work in the world, persistent people get what they really are chasing, what they want. So I also just happen to know another place that I think um, daily post. Did anyone start experiencing anxiety week or two after starting? Not necessarily right away. So that's the endorphin blockade idea that it take, and then the more time goes on, more blockade would happen. Would people overcome it? Possibly. I think that's the answer is individual, and I think that we really have to respect and honor the fact. And then what are the side effects? For me, when I take my doses too high, I get nauseous and very malaise, just feeling really unhappy and whatnot. Overstimulated feeling of LDN. I have personally have not gotten it, but side effects for me last between 1 to 2 weeks. I think it's really important that you back off and give the time for the endorphins to be made. It says that overstimulated feeling again, and then feeling grumpy. So that's very grumpy, irritable. I think that's normal for endorphin depletion and endorphin blockade. And does it go away? I think depends on your body. If your body is able to make more endorphin, and the level of the dose of the endorphin, I mean the LDN, is not super high, then I think that theoretically maybe 1 to 2 weeks, maybe a month, but it should get better. But if it doesn't, like I said, always talk to your doctor. And if your doctor doesn't know, then educate that doctor or find one that does. The headaches, same thing. I see headaches a lot for LDN. A lot of people don't refuse to get off headache, LDN, because it works for them. So, but again, same thing. I think that's all the side effects. I have several videos on this topic of side effects you can find in the YouTube, and I will drop my YouTube. And please consider subscribing to my YouTube channel because you will get updated whenever there is new videos that I upload, and more I will be uploading more videos through live. But I also do a lot of I will be doing a lot more shorts as well because I figured that that's what the algorithm appreciates. So I will drop my YouTube on the comments also, um, and and then you can look up like side effects, and there are many videos on side effects. So I think that that would help the person. And then let's see more questions. And I'm doing something different because I think I'm just looking for and answering one question from one person, looking through on a LDN group, not my group though. So it says I'm making progress with ultra low dose of 0.01. 10 micrograms, I guess, is considered ultra low dose, high end. But if anyone has an issue, then I would say like drop it to the lowest possible. And let me see if there are more questions. And again, I'm just fielding one question from one person, and I'm just going down because this person posts every day. So again, headache, and I think, like I said, anytime in my practice, again, this is not a medical advice. This is I'm just sharing with you what I do with my patients. If people have side effects, a little bit of break followed by re-challenge, and then this person says, I did this dose, very very small dose in the morning, and tried it again with evening dose, and then overstimulated. So that's very consistent again with how to get side effects. If you know a dose is um, low, and some people I increase the dose maybe once a month or once in 3 months. It really depends on them, and some people I will recommend even it's grams, milligram, microgram, nanogram. And so, yeah, I have used nanogram doses in the past. Terrible neuralgia, trigeminal neuralgia. LDN works really well for trigeminal neuralgia. I would say in my practice, perhaps even 80% of the people could claim that it worked better. And let's see. My doctor has left it up to me. I think that's a bit of a cop out. Go find yourself the right doctor, because it's not really cool for doctor to just abandon the patient. If they written the prescription, then the person's responsible. If you don't want to write the prescription, refer the patient out and find the right person. I think that's what I usually do. Um, let's see. We have more person, and welcome Brenda. Dopamine to their supplements while on LDN. I think that I get a lot of these questions, and it's about dopamine, serotonin. So what I can say is that I've written, once again, go to my YouTube channel, youtube.com/at Yunhan Kim MD, and I've done a number of these videos on serotonin, norepinephrine, dopamine, and the what I think the best way to look at endorphin is it's like between serotonin and dopamine. It's got happiness and it's got pleasure. It's got both, and that's what endorphins do. So, would do people add dopamine to supplement on LDN? Um, I don't know what you're talking about, dopamine. I don't know if you're talking about medication or you're talking about supplements. So what I can say is that I use LDN for patients with Parkinson, and they already take dopamine like medications, and I have other people taking supplements that contain dopamine and tyrosine, and and so if people do that, yeah, people do that. It's a thing, especially if they have Parkinson's. Once they have Parkinson's, then yes, that is something that they would be. There are people who do it. So now I'm gonna jump to our LDN group, and I'm going to see if there are. I think what happened is that one of the groups got shut down. Two of the groups got shut down. So we um, have been getting unusually high number of requests, and that's the reason I'm just very 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 strict about. Not just me, but our moderators are very. Um, so this person says that I'm at a loss. Gradually increased LDN, moved it to the mornings. Insomnia was resolved, and then the person decided to put some lithium orotate, and then let's see, tired and wired sensation, LDN back to 0.1. Um, does anyone have similar experience? Will it dissipate? So I think I'm gonna like duck that question and say this person, and I'm gonna actually closing the post, closing the post to comments. Please talk to your doctor, because it gets too close to, it just gets too close to what do you call, it just gets too close to medical advice, and I just don't like that in our group. I started LDN 2 weeks ago. Positive changes, less brain fog, more energy. Woke up a lot, night sweats, needing to go to the toilet. Um, Mood is better. Now I'm feeling down and emotional distress. So let's just go through that. Night sweats, needing to go into the toilet. Those are all LDN related until proven otherwise. I've had patients who had severe night sweats and needing to go to the restroom. LDN makes your gut work better, harder, and that's the reason that it works for SIBO because it speeds up the reaction. And the person says, "What should I do?" So this is another medical advice. I'm going to close it to the comment because, and then I'm going to turn. Another thing I do is I turn on post approval for people because I don't want to risk the group. I know that Facebook is um, very strict, and that's why we created school, and where we are a bit more freer with our discussions. But as long as we're here, we have to be careful. Liver enzyme, I posted an LDN. I posted a blogged article on that, and I don't think we have to worry about it. But if you're a provider, then I think it's always a good idea to check it or check the uh, med- complete metabolic panel. It's not a very expensive panel, and it gives you a lot of information. So that's that. This person, let me go back and check with see if there are more questions in more comments, and there are no more comments from the viewers. And it looks like Friday night may be a better time than Saturday morning. That's my observation. It's just that I want to find a London time that works well for our viewers in England and Europe. This person says, I've been on LDN for 2 years for chronic fatigue and myalgic encephalitis, fibromyalgia, hypermobility. Started very low and titrated slowly. It helped a lot. How many people are taking more than the usual dose? And I said, I think that this question is quite appropriate. It's not, but my answer is it depends. And again, if you should talk to your doctor about that. Um, so if there are no more questions, I think a lot of the issues, I reached the end of what we discussed yesterday. So I will wait for questions. And if there's no more questions, I think I may sign off because my AC decided to take a nap. And so I have to address that issue. And the gentleman who's responsible for that is headed on this way. Well, I wish everyone a happy Saturday. And my guess is that I'm gonna just keep the Fridays. That seems like that was a better turnout for me consistently. So that's what I'll do. So last chance to ask questions. All right. Thank you. I appreciate you, all of you. Thank you.